Hello, this is Dr. Robert Bouvier with Dr. New. You've come here to learn a little bit more about the clinical pearl of overnight oximetry. I don't know if I can spell that word.
It's a tough one.
Good friend here, and the reason he's here is because the number one thing when you talk about any kind of work, that you have to have somebody that you trust and a vendor that you very trust. And Senior Home Care has been an absolute wonderful godsend for our practice and hundreds of patients that they take care of. Kevin, we're talking about obstructive sleep apnea and other things that we do pulse ox for. Give me the lowdown on why we should do overnight pulse ox.
Well, overnight pulse oxing is really your number one catch for your patients. When you do a pulse ox test for them and they complain of shortness of breath or other issues that are going on,
Fatigue, tiredness,
you don't always catch that here in the office. But an overnight pulse ox test will catch what's going on with them while they're sleeping.
I've got a bunch of those COPD patients
Tons.
that they're normal here. You know they qualify for oxygen. They wake up with a headache. They're tired. You know, you're considering it, and maybe they don't have obstructive sleep apnea, but the COPD itself. And so I know some people are on that borderline. Their spirometry is 80%, maybe 85%. They're kind of in the borderline. But boy, their overnight pulse ox has been blaringly positive, an hour or two sometimes, where they're desatting less than 88%. So we're making a list of things here. Some of the take-home points, and we'll review this at the conclusion, but COPD, CAD, CHF, obstructive sleep apnea, and then central sleep apnea. Reasons for doing overnight pulse ox. Any other reasons you can think of why we should do it?
Well, any complaints that they would have. When they start talking about shortness of breath or fatigue, those are just really
morning headache,
quick signs for you to say, let's check and see what's going on with that patient.
So another screening device that we do for COPD is the Epworth test. And that's more for obstructive sleep apnea, but almost all my COPD patients, anytime I consider obstructive sleep apnea, we do the Epworth scale test, and I'll add that to the email that I'll send you as well. So this is Dr. Robert Bouvier. These are clinical pearls about using pulse oximetry overnight, and the take-home points are: number one, have a good vendor. Number one, have a good vendor that you trust. And then number two, the diagnosis that you're looking for to help clarify would be COPD, CAD, CHF, obstructive sleep apnea, and central sleep apnea. Again, this is Dr. Robert Bouvier with Dr. New. Have a great day.